I'm talking economic status, rural healthcare access, lack of nutritional food and clean water for the public. We can't all play neighbours like in Ramsey Lane, but we can at least help out with the expectation of gain. Yeah. Whoa, didn't see you there. Welcome to Alice Springs, also known as Alice, the Alice, or Mapamtwe. Alice Springs is located in the southern part of the Northern Territory and lies directly between Darwin and Adelaide. In other words, right in the centre of Australia. It is the third largest town in the Northern Territory with a land area of 570,000 kilometres squared. Interestingly, it is categorised as RA4 on the ASGA RA classification, making it a remote area. Alice Springs lies in the heart of Central Australia, straddling the Todd River on the northern side of the Macdonald Ranges and comprises cavernous gorges, boundless desert landscapes and remote Aboriginal communities. Fluoride also occurs naturally in Alice Springs, drinking water supply at a level of approximately 0.4 milligrams per litre, which is sufficient for dental health protection.
In the town of Alice Springs alone, there's a population of 28,000 people as confirmed by the 2016 census.
This figure, however, may not entirely be accurate, due to itinerant populations and those not partaking in the census.
The population itself can be further broken down, with 18.6% comprising of Aboriginal and Torres Strait Islander people, and a ratio of 14,868 males to 13,104 females. The median age in Alice Springs is 33.4 years of age, whereas the national median is 37.4 years of age. The main Indigenous group in Alice Springs are the Central Arundel people. Thus, the traditional language of Alice Springs is Arundel, with there being many different dialects of the language. English is generally their second language.
Alice Springs has 19 government and non-government schools/colleges, with 2 schools dedicated to Indigenous students and 7 preschool students. Some of these schools include St. Philip's, Centralian Senior College and Bradshaw Primary School, to name a few. The only public transportation in Alice Springs is a very limited bus system, which operates Monday to Sunday, excluding public holidays. Buses arrive every 1.5 hours, and as such, people in the community may have to wait a very long time to travel via bus.
The Alice Springs Hospital provides a number of services ranging from rehabilitation services, intensive care units, pharmacists, GPs, visiting specialists including cardiology, dermatology, diabetes and geriatrics. St. John's Ambulance also provides emergency and non-emergency ambulance services to people in the Northern Territory. Ambulance crew are available 24/7 to respond to emergency cases with a base located in Alice Springs. In the field of dentistry, there are 4 practices, including a hospital setting that have a total of 10 dentists and 2 prosthodontic labs.
There are also other services available, including service stations and 2 large supermarkets, open from 6 a.m. till 10 p.m. every day. Oh, hey Doc, what are you doing here?
Oh, hey Sheriff, I was just about to talk about the major challenges facing Alice Springs.
Oh, great. I just had that exact same idea. Why don't we talk about it together?
That sounds great. There are a number of health issues in Alice Springs, including the rising rate of obesity, diabetes, and chronic disease. Alcohol is easily accessible and is a significant health issue affecting the Alice Springs community, particularly with Indigenous communities. Mental health problems such as depression and anxiety related to chronic stress are also prevalent.
That's right. There are also existing social issues within Alice Springs. These include issues with school attendance and regular dental visits. Long wait times for appointments are commonplace, and one can expect to be placed on a waiting list to visit a public dentist. Private dentists are often expensive, and most people cannot afford to visit them. Education is a problem, and consequently, there is often violence fueled by alcohol and drugs. Being in the centre of Australia, the climate of Alice Springs is one of extremes, ranging from hot summers to cold winters. During winter, average temperatures may fall between a chilly 4.8 to 20 degrees Celsius, with July being the coolest month. In summer, temperatures may soar up to 40 degrees Celsius. Jeez, that's bloody hot. So make sure you plan ahead before you head down to Alice Springs.
I should definitely contact someone about this.
Or maybe I should call George.
Hello, George speaking from Alice Springs High School.
Hey George, how have you been? It's been a while since we last talked.
Sorry, who's speaking?
It's me, Billy, your old mate from high school. I heard you're working in Alice Springs as a teacher. You're not busy right now, are you?
Oh, great, how have you been? Yeah, you'd be right, mate. It's okay, I'm just on my lunch break right now. Just finished teaching my humanities class.
So I've recently signed a 5-year contract to work in Alice Springs, and I would like to know more about the education system over there. Will you be able to give me some more information?
Okay. So, at the time of the 2011 census, the proportion of 25 to 34-year-olds in the Alice Springs ESA who had completed Year 12 or equivalent was 55%, smaller than the Northern Territory and Australia, which were at 58 and 75% respectively. Furthermore, the 2013 National Assessment Program Literacy and Numeracy Summary Reports results showed that 30.4% of Year 9 students in the Northern Territory did not meet the national minimum standard for numeracy, reading and spelling, significantly higher than compared with results from Australia. Job seekers who have not completed Year 12 and have limited experience in the workforce are likely to lack many basic employability skills that employers value and look for in applicants, particularly for lower skilled vacancies and entry-level positions such as apprenticeships and traineeships. Hold on, just let me send you a link to this short clip regarding the employment status in Alice Springs.
Okay, thank you George. I'll just have a quick look now.
In the 2011 census, it was noted that 13,194 people were employed in Alice Springs, and 15.1% were working in healthcare or the social assistance industry. That meant only about half the population was employed.
Yeah, that's right. According to the ARS Labour Force data, the median income for Alice Springs in the 2013 was $53,104. In June 2013, the unemployment rate in the Alice Springs ESA was 6.5%, well above the unemployment rate in the Northern Territory and Australia. That is 5.3% and 5.7% respectively.
The Alice Springs LGA recorded the lowest unemployment rate within the ESA of 2.7%, while the Central Desert and McDonald LGAs had high unemployment rates of 20.7% and 21% respectively. From June 2012 to June 2013, the Alice Springs ESA unemployment rate relatively remained stable with an increase of 0.2 percentage points.
The major industries in Alice Springs include agriculture, mining, manufacturing and tourism. There was on average 5.4% of occupation vacancies that remained unfilled. This was above the average for all regions in the 12 months leading up to March 2013. This was 4.3%.
Specifically, the highest unfilled rate was for managers and professionals, 16.7%, followed by technicians and trade workers, 11.1%, clerical and personal service workers, sales workers and machinery operators, and drivers reported no unfilled vacancies.
Good morning, Billy. This is the Mayor from Alice Springs. We're excited to know that you've signed a contract to work in Alice Springs. I'm just ringing to see how your community engagement plan was coming along.
Oh hey Damien, I've done a bit of research and decided that my purpose and objective is to educate and improve the oral health of the community by delivering accessible and effective dental services. Maybe you can help me out here.
Sure, I'd be happy to. First, you need to make sure that you have a SMART objective. It has to be specific and well-defined. It has to be measurable, so you need to know if your goal is obtainable or how far away completion is. It has to be agreed upon, so all the stakeholders have to agree on what the goals are. It has to be realistic within the availability of resources, knowledge and time, and it also has to be within a good time constraint, so enough time to achieve the goal. You also need to know more about the local consumers and community profile. This may include the Indigenous elders of the Central Arrernte people, who may not only give you insight into the barriers preventing access to healthcare, but also ways of developing culturally appropriate services. You can also talk to general community members who utilise these health services as they will give you some insight into the needs of the community, which includes expressed, felt, normative, and comparative needs.
I was also thinking maybe talking to other community groups, minority groups, and disadvantaged groups such as the elderly.
Hey, that's a good idea. Now, it is also important to know the potential stakeholders within the community. This will give you the opportunity to not only tap into local connection and networks, but also help identify what engagement programs already exist, what is working, and what opportunities there are to work in partnership with other organisations. We have a public hospital where they can communicate with you the health issues that are common in Alice Springs. You could also work with the town council as they can provide and advocate for the various health services available.
I was also thinking that I could talk to principals, teachers, and established dentists in Alice Springs. They would be able to advocate for oral health within the community.
Yes, it will definitely be good to consult them. You could also engage with media outlets such as Central Australia Aboriginal Media Association, which primarily uses radio and television communication to deliver its messages to the wider Indigenous community, particularly with those with limited internet access. Did you have any other questions, Billy?
Okay, just one more thing, Damien. What engagement activities are currently in place?
Yeah, so the Australian government launched the Closing the Gap program in 2007, which was committed to reduce the gap on health, education, and employment between Indigenous and non-Indigenous people by 2030. As part of this program, mobile dental vans were implemented to provide services in Alice Springs. In 2014, the Child's Dental Benefit Scheme was also introduced. Children in the Northern Territory between the ages of 2 and 17 years of age are now entitled to free access to public dental services.
I also read online about the Aaron's Land Environmental Centre.
They are a not-for-profit organisation that deals with conservation and responsible management of lands, water and natural resources of Central Australia, with the goal of healthy futures for arid lands and people.
Okay, well I think you've told me everything I need to know about the community, so thank you for that.
It was my pleasure, Billy. I'm excited to see the engagement plan in action. See you later.
Bye. Okay, I seem to have a grasp on some of the issues in Alice Springs, but I still need to come up with a way of delivering my community engagement plan.
Hey Billy, it's your mate Norman. We heard that you managed to get a 5-year contract for an engagement plan in Alice Springs. How's that one going?
I haven't started yet, but I'm still trying to get my head around how to implement my plan. Do you have any time at this moment? Maybe we could meet up and discuss it.
Yeah, definitely. Why don't we meet up at my place?
Alright, I'll see you soon. Okay, bye.
Hey Billy, mate.
Hey, Norman, it's been a long time.
Yeah, long time no see.
Alright, are these your friends here?
Yeah, these are my mates. This is Ryan. This is Peter.
Nice to meet you.
Nice to meet you. Yeah,
Right.
since we're doing the community engagement plan, I just
Yeah.
thought it'd be a great idea if we get other opinions.
Yeah, sounds good.
Yeah, so what do you have so far for your community engagement plan?
Well, it'd be better if I draw this diagram out for you, and then we can continue from there. So there are 8 steps in the plan that would help me better understand and target local demographics in and around Alice Springs. I have a sound idea of how to scope out my engagement plan, but I'm still unsure about how I would put this plan into action.
So it's important that you target your main issues. Do you have any idea what your priorities are?
I have. As a new dentist, my influence within the health community at Alice Springs may be limited, but I think I might have a few ideas to help change things. Firstly, it's important to reduce any barriers to dental care. With Alice Springs being an ASGRA 4 regional centre, geographical barriers would exist for patients who have to visit from afar. In addition, the low socioeconomic status of Alice Springs may affect patients' ability and attitudes to visiting dentists. If they perceive that they are unable to afford dental care, then they simply wouldn't visit me, no matter how hard I try.
Well, maybe you could collaborate with some of the existing health professionals around Alice Springs.
That could work actually. If we all work as a team, we could definitely see a broad sweeping increase in education and health awareness around Alice Springs. I could call upon members of the community to help participate, and this way the onus is shared among all community members and not just us dentists. This means that we could have equitable access to dentists and other health services. That way, even with difficult access to dental and other health services, at least they would understand the issues relevant to dental care.
Yeah, look, Billy, have you had any thoughts about how you might go about implementing these ideas?
Well, I had a brief read about community engagement, and I realised that there are 3 levels of engagement that I needed to focus on. These are informing, consulting, and collaborating.
Oh, I think I know what you're talking about. Informing is a one-way method of communication. It allows the community to better understand the health issues and services. Instead of second-guessing things, it would help the people make informed decisions regarding their health. It's pretty easy to understand. It is relevant and is culturally appropriate. Billy, have you thought of some other ways that you could convey this information to the general public?
Well, I think since Alice Springs has a variety of community groups, I think it would be a good idea to use a variety of mediums for communication. I remember watching an ad earlier today, and it seems that delivering messages through radio, TV, newspaper articles, and via the internet would be an excellent way of reaching all members of the community. For radio stations, I could contact the 8CCC FM radio station and the Central Australian Aboriginal Media Association.
I know there are some pretty big sporting events there, like the Hearts Range races and Red Centre Nats, which are held every year. Maybe you could set up an information table promoting health messages?
Yeah, that's right. Working with schools and attending community information meetings would also be an effective way of reaching out to all members of the community.
Oh, I think Billy should keep in mind that with informing, it's easy to reach lots of people in hard to reach places, but it can get expensive pretty quickly. Also, it isn't a two-way relationship, so it's difficult for people to ask questions or clarify information. I feel that it is important that we discuss other levels of engagement as well. With consulting, there is a two-way relationship that you're able to seek views and ideas on certain issues. Do you guys have any ideas on what Billy could do?
Well, I guess you could hold focus group talks to certain groups in the community. In this way, people can discuss their ideas in an open and relaxed environment. The main benefit is that particular interest groups, such as the elderly, teenagers, and Indigenous people, can be targeted, which may have been excluded from wider engagement activities.
Yeah, that's right. I think I remember reading that council community forums are also held every month. This would also be a great way to engage with the community and allow for public questioning time.
Right, so this allows you to understand the needs and aspirations of the community, but at the same time develop good rapport, trust, and respect within the community. But this method is maybe pretty time-consuming, but also costly, and sometimes individuals may feel over-consulted with no clear outcomes. The next method of engagement is collaboration. This involves active participation from the community in shaping their own health needs, services, and outcomes. The main benefit of this method is that it encourages capacity building and develops a sense of ownership within the community. Can you think of any way that you can collaborate with the community?
Yes, I could work with schools and sporting clubs such as the AFL Central Australia, where we could hold oral health workshops to demonstrate good oral hygiene practices and dental first aid related to sports injury. Holding roundtable discussions with consumers and potential stakeholders would also be an excellent way to discuss issues and come to conclusions as to what could be done.
When deciding all this, I think you should keep in mind some barriers like hard-to-reach groups and divided communities, and where might you even hold these events, or maybe even if interpreters or signers are needed.
Oh, very nice, Billy. So how would you assess the progress of your engagement plan?
Well, since there are monthly meetings with the local communities, I could obtain verbal feedback whether or not the community engagement plan has been effective. Short surveys could also be given out during our oral health workshops, focus groups, and community events to express opinions on the program so far.
You could also see if more people are using dental services and the level of compliance with follow-up appointments.
And before you implement any of these strategies, make sure you consult and engage with the Indigenous community in Alice Springs. Ensure that trust and permission is attained prior to carrying out the community engagement plan. Make sure that the health plan is understood by all, whether or not this means translating the information to the appropriate Indigenous languages. Lastly, ensure that the health services are carried out in a culturally appropriate manner.
But what could I do to engage with elderly people?
Maybe you can ring up some aged care centers or nursing homes to organize meetings with them and set up online surveys to reach elderly that stay at home. This may even get some of the stakeholders to advertise your survey.
Thank you guys, this was really helpful. I'll keep you guys all up to date on how my community engagement plan will be going in the future.
Life seems to be difficult at every turn, getting harder and heavier as I go on. Barely breathing with this weight on my shoulders. Gotta keep going and knock away these boulders. Small things in life that seem little by themselves form into big things that impact our health. How does it all relate? I don't see the picture, let me explain to you with the step-by-step lecture. From the day you were born, you may be predisposed to nothing wrong, but that's just how it goes. Extreme health disparities in our modern world, how is that even possible? Is this some sort of underworld? It's not affecting me, and do I have to care? It's so far away and I've never been there. Aren't there enough dentists? That's a good question, now it's time to make the honorable mentions. I'm talking economic status, rural healthcare access, lack of nutritional foods and clean water for the public. Yo, can't play neighbors like in Ramsey Lane, but we can at least help out without expecting gain. Promoting healthcare equality, not some sort of insanity, but believe me, it can be hard to avoid this pageantry of apathy. This sort of indifference is plaguing society. No wonder there's a rise in depression and anxiety. I wanna see my ideas and dreams come to fruition. With a bit more dedication, we can form an equation to encourage stimulation, the thinking of plans to address this issue of the aging population. The list of problems goes on, and believe me when I say they ain't gone. I'm talking climate, transport, and fresh food, and don't get me started